Hi, my name is Fazaldeen Mogul. Today I'm going to be showing you an instructional video on how to create an endovac for treating esophageal perforation. So what you're going to need for this is a needle driver, a 2-O-proline, suture scissors, 14 French NG tube, and a small black sponge that comes in the vac kit. So first we will perform a diagnostic endoscopy to evaluate the size of the perforation cavity. Then you will create an appropriately sized sponge. It's important to remember before you connect the sponge to the nasogastric tube that you have to thread the nasogastric tube through the patient's nose and pull it out of the patient's mouth. Now you can do that by manually palpating the tip of the nasogastric tube and pulling it, or you can use the endoscope and use a grasper to grasp it and pull it out. When you measure with the endoscope, you can use the scope and measure the tip of the scope and see how far the scope is to measure the cavity, and then use a ruler to kind of measure the sponge. And let's say this patient had a 4 centimeter cavity. You can take this, just cut the sponge here. It's an appropriate size. So to manufacture the endovac sponge, you'll first cut the tip off of the NG tube. Make sure that the holes are all being covered by the sponge here, so we can actually trim a little bit more off here. So that the tip of the sponge is just within the cavity. And you're going to roll the sponge around the nasogastric tube. We're going to use a 2-O-proline to come through the sponge and then through the nasogastric tube and then through the sponge again. You want to make sure these are secure, as these will be in for about 3 days at a time. You can put about 2 or 3 sutures through here. So when you're getting close to doing your third stitch, you're going to make sure that the tip of the NG tube is not poking out through the tip of that, so you can trim that down a little bit. This is all done kind of on the back table. Okay, when you're doing your last stitch, you're going to come right at the tip of the sponge and NG tube, kind of go through in the same way. And what you're going to do here is tie down this knot. You're going to do a few throws here to cinch it down. And then what you're going to do is create a small loop with an air knot that will help you grasp it using your biopsy forceps. So we're going to do one throw here, and then you can put the scissor in here. Yep, and then we can do a couple throws on top. You can see you have this small loop here that you can grasp with your biopsy forceps and help bring it down into the perforation cavity.